Welcome, everyone. Bienvenue tout le monde. Sejam bem-vindos. My name is Jordan Burns, and I'm a technical advisor for the United States President's Malaria Initiative, or PMI, which promotes global and local malaria prevention and control efforts. PMI is currently present in 24 focus countries in sub-Saharan Africa, as well as a sub-regional program in the Greater Mekong in Asia. And it delivers cost-effective, life-saving malaria interventions, such as insecticide-treated bed nets, indoor residual spraying, essential medicines and diagnostics, alongside technical and operational assistance to equip and to empower partner countries to end malaria. However, PMI's success in fighting malaria depends heavily on strong partnerships at multiple levels. So as a result, our team is also focused on developing and learning about effective ways to engage and support community and faith organizations in the collective fight against malaria. So in today's webinar, we will actually be highlighting a new resource that was recently released called the Malaria Social Behavior Change Toolkit for Community and Faith Leaders. The purpose of this toolkit is actually to serve as a resource for and to empower national and provincial level leaders of faith and community organizations to use their own strengths, their own community connections, and their own resources to educate local communities on how to prevent malaria and to seek appropriate care for fever. So the toolkit was first launched 2 weeks ago via a public webinar and accompanied by remarks from various guest speakers. And some of the key themes that emerged from those presentations included the following. First, the fact that engagement with community and faith-based organizations and leaders is so critical to the fight to end malaria, particularly in the hardest to reach communities. That such organizations and leaders are trusted and well positioned to promote behavior change, advocacy, and mobilization to achieve healthier communities and outcomes. And finally, that despite the numerous challenges that communities often face, there are already so many stories and examples of successful partnerships that demonstrate what can be achieved when common goals and values are aligned. And we all have an opportunity to work together and to create more partnerships in this space. So we hope that you'll find today's webinar helpful and useful in demonstrating the key components of the new toolkit, as well as its potential uses for your own work that continues to inspire, inform, and truly make an impact in this fight. So we also hope that you'll take the tools today and make them your own by tailoring them to your own context and needs. With World Malaria Day only a few weeks away, we hope that these resources and today's conversation will serve as a catalyst for planning activities in communities that you serve. So on behalf of the U.S. President's Malaria Initiative, I do thank you for your time and interest. And now I will pass the floor on to Anna McCartney-Melstad, who is a Senior Program Officer 2 at Johns Hopkins Center for Communication Programs, to give us an orientation on the new Malaria Social Behavior Change Toolkit for community and faith leaders. So over to you, Anna. Thank you.
Thank you so much, Jordan, for that background information. That was super. As Jordan said, my name is Anna McCartney-Melstad. Some of you were with us for the launch of this toolkit 2 weeks ago, and thank you for being with us again today. Before we get started, we are going to have a number of polls throughout this webinar today. So we'll be asking each attendee to answer poll questions in the Zoom platform. These questions will be available in English, French, and Portuguese. And in a few moments, a poll question is going to pop up on your screen in a separate window if you are using the Zoom app. If you are using Zoom in your browser, a window will pop up in your current browser window. For each poll, you'll have about 1 minute to respond to the poll, and don't forget to click on the Submit button. If the poll does not open on your screen, don't worry, no problem. You can type your answer into the chat box instead. We will be reviewing the responses to each poll. However, you're not required to answer. Let's go ahead and get started with our first poll. What is your role in your community? You can see there are a number of choices. Please select and click on Submit. We will have 1 minute for this poll. The options are religious leader, community leader, implementing partner, NMCP, district level staff, SBC professional, scientist, community-based organization staff, healthcare provider, or other. And if it is other, please go ahead and type in the chat box what category you fall into. And I think we have about 20 seconds left. Hopefully people are finding their way to the button that they need to click to correspond with their answer, and don't forget to click on submit. Okay, we should be wrapping up soon. Okay, so we can see that the results show that we have about 36% implementing partners, and about 28% of participants are SBC professionals. And the NMCP makes up about 13% of participants so far. This is great. We really love the diversity of folks that have signed on for today, and thank you and well done for answering your first poll question. Okay, next slide, please, Ashley. We want to thank the other leaders and panelists on the last launch that we did 2 weeks ago. We were really fortunate to have some very high-level participants, including Dr. Raj Panjabi, who is the U.S. Global Malaria Coordinator for the U.S. President's Malaria Initiative. We also had Joy Fumafi, who is the Executive Secretary for the African Leaders Malaria Alliance. We had Miriam Wamala, who is the co-chair of the RBM Social and Behavior Change Working Group. We had Dr. Lamine Bangora from USAID Guinea, a malaria specialist. We had Reverend Chakoya from the General Secretary from the Council of Churches in Zambia, and Pascal Umulisa as well, Executive Secretary for the Girl Guides Association of Rwanda. So thank you very much to those who joined us in the last webinar. Next slide. So for those of you, and this is a pretty diverse group of folks, you know, just a quick note, why malaria? You know, despite recent gains in malaria in the past 15 years, even though we have made terrific gains in malaria, it continues to be a huge problem. And in recent years, we've even been a bit worried because it seems that our progress is stagnating and in some cases, even regressing a bit. This disease impacts everybody that it comes into contact with devastating short and long-term consequences. And the most vulnerable suffer disproportionately. The most vulnerable are often what community and religious leaders are working with on a day-to-day basis. And malaria has always been and will continue to be a core barrier to development. It impacts the economy, health, and society. Next slide. So what is SBC and why does it matter for malaria? Some of us are SBC professionals on this call right now, but not all of us are. And in fact, the audience for this toolkit are not SBC professionals, but rather community and faith-based organization or leaders who are working with similar mandates in working with people, but not necessarily for malaria. Social and behavior change encompasses health communication, social and community mobilization. With these components ranging from interpersonal communication between a community health worker and their client to multi-level mass media campaigns, SBC, social and behavior change, are evidence-based and theory-driven interventions, and they're integral to all types of health promotion and disease prevention, and they have been shown to significantly improve behaviors. Human behavior and community engagement are essential elements in the fight against malaria. And most importantly, without social and behavior change, we cannot sustain the massive gains that we have made in malaria and prevent from sliding backwards. So why community and faith leaders then? Well, local leaders are crucial in helping communities take action in the fight against malaria. We know that community members must receive support from sources that they know and trust, who understand their needs and their values. And community and faith-based organizations provide these key connections and trust within communities. They help families better understand malaria and impact their attitudes, perceptions, and social norms. This leads to sustainable and long-lasting change. Social and behavior change is grounded in community engagement, and ownership is shown to reduce malaria and save lives effectively. So there is a key role for our community and faith leaders, hence the need for this toolkit. Next slide. So here is the URL, communityleadertoolkit.org. You can enter this into your browser on your telephone or your mobile device. The toolkit is optimized to be best used on a mobile device, although you can also use a computer to access the toolkit. The intended users for this toolkit are national and subnational leaders of faith and community-based organizations. And these materials are to be used to be further adapted to suit your programs at the local levels. This toolkit is yours. Take it and adapt it as you need it. Take the pieces that are helpful and leave the pieces that aren't. Translate this into local language if you see fit. The only part of this toolkit that should not be changed is a module on key prevention and treatment actions, which should not be modified without guidance from your Ministry of Health. Navigation. I will now be taking us through some of the key navigation features of this toolkit. Please bear with me if you are technically advanced, but for folks like me who take a bit to get oriented to things, I will briefly take us through the toolkit navigation features. And as Lindsay mentioned, the QR code is provided in case that's the way you access your websites. In the top right, you can see the languages feature. This toolkit is available in French, English, Spanish, and Portuguese. So go ahead and click on the language that you need. As I said, you're welcome to take this toolkit and further translate it into other local languages as well. But those are the 4 key languages it is currently available in. On the far left, you'll see a button about the toolkit. That is next to the home button where you can find out more about the development of this toolkit. The home button on the far left of the screen is the link to the home screen. The home screen is where you can always navigate back to if you're finding yourself getting lost in the weeds. And it is the place where you can navigate to the rest of the toolkit as well. So about the toolkit is right next to the home button, and this is where you can find out about the development of the toolkit and some of the process that we use to develop the toolkit. The button next to that is the core content of this toolkit. There are 4 modules, which we are going to discuss in depth later. Next to that button are the resources. Although each module has its own resource section, which we're going to discuss as we go along, this page has some more general social and behavior change resources on all of the blank worksheets and exercises that are found throughout the toolkit. The next button to the right are the acronyms and glossary. The acronyms and glossaries contain the key acronyms and terms that users might need to reference. But we did try hard to ensure that there's not too much jargon throughout the toolkit. The next button are the frequently asked questions. The frequently asked questions are broken into 2 sections. The first is how to use the toolkit, and the second are frequently asked questions about malaria prevention, control, and the disease itself. This resource will be helpful if you are trying to figure out how to answer, for example, myths and misconceptions in the community. The last button is the Contact Us button. And this is where users can sign up for updates to the toolkit and to access other malaria social and behavior change resources. And also an email contact is listed in case you have other questions. Thank you for bearing with me. I wanted to introduce an example of an organization that we are going to reference throughout the training today. Our ongoing example is the Magongo Mosque Outreach Council, which can be seen here. And I'll tell you a little bit about this example, and we'll revisit this example as we go through. So this is a community mosque on the outskirts of Mombasa, Kenya, in the Magongo, Santana neighborhood. The head imam is Ali Rahman. 75% of the neighborhood attends this mosque, and 85% are affiliated with the mosque. The Outreach Council is made up of mosque leaders and volunteers. We will learn more about this, the Magongo Mosque Outreach Council as we go along, but we thought it would be nice to follow an example as we work through the different modules. So just to say that this is based on a real life mosque, but some of the details are filled in for the benefit of this webinar. Okay, so now we're going to navigate back to the middle button, the SBC Toolkit for Community and Faith Leaders. This is where the bulk of the content is. And the content is divided into 4 main modules: context, malaria actions to promote, using malaria SBC in your work, and advocacy. So the first module, context, helps users to investigate the extent of the malaria problem in their areas. Learn what the ongoing efforts are. Can you click to the next slide, please? Thanks. And identify who to coordinate with. And these are some of the key first steps in when community and faith-based organizations decide to take on malaria activities and integrate them into their existing activities. So next slide. So the introduction to the context module really orients leaders on how to gather information about malaria. And it highlights some really great examples of religious and community leaders fighting malaria in Zambia, Uganda, and Mozambique. Next page. Yes, thanks. So part of the context module suggests that community and faith-based leaders take on a situation analysis before doing any malaria activities. It's very necessary to do a thorough situation analysis before you jump into any malaria work. And this is going to require you to become somewhat of a malaria detective to find out the lay of the land in your area. Your first stop should be to your local malaria Ministry of Health official, who can provide you with many answers to your questions. Things to ask about include what the malaria burden is like in your area, in your country, what the malaria interventions are and the status of them, what are the national targets, what are your local targets, who is funding what and where, what kind of information is there available for action. You need to know about the community members and their current behaviors when it comes to malaria, and also some barriers and facilitators. So these are questions that you can find out through doing a situation analysis. And the toolkit does take you through the steps of doing a situation analysis. And so that, like I said, this is a very important first step. So now we're going to go ahead and do a poll question. So as you see, the poll question has popped up. Please select your answer and then hit submit. We will take 1 minute for the poll. And the question is, if you're planning a malaria activity, what are some things you would like to know? And you can click all of them that apply. Who is in charge of malaria for the local government in your area? Other malaria partners in your area? And or local malaria rates? Please select your answer or answers and don't forget to hit submit. We will take just 30 more seconds for this poll. Maybe 15 more seconds. I see we have about 100 participants. That's super. This recording, as Lindsay said, will be available, and you can pass this on to others who weren't able to join us as well. Okay, I think we should be wrapping up the polls soon. Okay, so the answers that we see are 83% of folks said who is in charge of malaria for your local government area, other malaria partners in your area, and local malaria rates. Okay, these are great answers. If you're planning a malaria activity, ideally you would know about all of these. You would ask all these questions. But as I had mentioned earlier, it's extra important to know who's in charge of malaria for your local government area. So I think everyone did a great job of answering these questions. Thank you so much. So going back to our example that we talked about earlier, the Magongo Mosque Outreach Council did a situation analysis. They spoke with their county malaria focal person using the tools in this toolkit, and they learned the following information. They learned that in their area, malaria accounted for 45% of outpatient attendance, 30% of death among children under 5 years old, and 20% of pregnant women's deaths. They learned that there are free mosquito nets being distributed next year, that there's currently free testing and treatment for malaria for children, and that with antenatal care comes free mosquito nets and preventative treatment. They also learned that the funding situation that Global Fund buys mosquito nets, and NGO X, for this example, I won't mention which NGO it is responsible for delivering those nets. They also learned that sometimes people report to the health facility too late when they're ill with malaria, and that sometimes people die that could have been saved if they had come in earlier. They learned that mosquito net use in their area is high. They already knew that there was little cultural and religious diversity, but noted it in their situation analysis. And notice that there are some good barriers and facilitators, and one that is that the mosquito net distribution had been delayed due to COVID, and another is that antenatal care rates were low, attendance was low. Some good facilitators is that most of the children attend school, parents want the best for their kids, and there's lots of participation at the mosque. So you can see as this group went through and did their situation analysis, they were able to learn a lot about the malaria situation. And that's really important as they go forward to plan activities. So each module has additional resources at the end of it, which include case studies, places to get more information, and specific tools, templates, and manuals. So this is the end of the first module that has these additional resources. And before we go to the next module, we have another poll question. You'll see it pop up on your screen. Please scroll down and select your answer and then hit submit. We'll take 1 minute for this poll. So the question is, what are the key behaviors we want to promote within communities? Clean up around the home. Go directly to the chemist to buy chloroquine. And 3, sleep under mosquito nets, treated mosquito nets every night. Please select one of these key behaviors for your answer and hit submit. If you're a malaria SBC professional, this will be an easy question for you. But for those of you new to malaria and social and behavior change, hopefully this will be a learning opportunity. Don't forget to click on submit. So we should take about 20 more seconds, I think. Okay. We should wrap this up. Okay, excellent results, excellent results. 88% of the answers were absolutely correct. One of the key behaviors we want to promote within communities is sleep under treated mosquito nets every night. Thank you very much for your answers. We did have 12% who mentioned cleaning up around the home. This is actually something that has been disproven in papers that actually go back a number of decades, that cutting grass around the home and cleaning up around the home isn't effective for malaria transmission, but is effective for breeding for other types of mosquitoes. So, but we want to focus on the key behaviors that are proven to interrupt malaria transmission, and sleeping under a treated mosquito net every night is one of those behaviors. So the next module takes us through those key actions to promote, to prevent and treat malaria. And there's also an overview of malaria as a disease. As I mentioned earlier, while the rest of the toolkit can be adapted as needed, this module should only be changed based on advice and guidance from your Ministry of Health. So each behavior to promote lists the very specific behavior and key messages about those behaviors. For the first action to promote, every household member should sleep under an insecticide-treated net every night. The key messages, as per the WHO guidance, are: insecticide-treated nets act as a barrier that keeps mosquitoes away from people. These key messages are very direct and very short. Insecticide-treated nets are also treated with a chemical that repels, weakens, and kills mosquitoes. Insecticide-treated nets are safe for use according to the WHO and are not harmful to babies, children, or adults. And insecticide-treated nets protect people from malaria and should not be used for other purposes. So when you're going through and thinking about how to integrate malaria into your ongoing activities, this is really important that you are very, very clear about the key messages for each of the key actions to promote. So the other key actions to promote follow the same format, and they are around treated net care, antenatal care and malaria and pregnancy, care seeking for fever, malaria testing, and malaria treatment adherence. There are also two key actions to promote that depend on geographic location and availability of resources. Indoor residual spraying, which includes spraying insecticide on the inside walls of homes, which interrupts the malaria transmission cycle, and seasonal malaria chemoprophylaxis for children under 5. So while you're conducting your situation analysis for malaria, you will learn if either of these key actions are happening in your area. If not, you can focus on the first 6 key actions. This module also has additional resources for each of the key behaviors with more technical information and materials. And as always, if you have any questions about the key actions or any of the technical information, a great place to start to ask is your local Ministry of Health National Malaria Control Program contact person. Otherwise, we saw earlier that there's a contact on this website, and you can feel free to contact us for more information as well. So the third of the 4 modules is using malaria social and behavior change in your work. Now, while the academic field of social and behavior change might be new to some, many of you routinely use these concepts on a daily basis, but may call it something else. This module takes users through the 7 steps in planning for integrating malaria social and behavior change efforts into their ongoing activities, with many resources to use directly, including several practical exercises and worksheets. Step 1 is about aligning values. This step asks users to reflect on their organizational mission and the community's values to see if they align with the malaria prevention and treatment efforts, and often they do. Step 2 is examining your audience. Nobody knows their congregations or beneficiaries better than community and religious leaders. This step asks us to consider their beneficiaries, but not within the context of the religious organization or community organization, but rather within the context of malaria. So if we look at our example organization, the Magongo Mosque Outreach Council, they looked at their members and identified a few key groups, including younger mothers of children under 5 years old, younger students attending madrasa classes, and mother-in-laws of younger mothers. They identified key characteristics about these different groups, such as their average ages, marital status, types of occupation, living situation, etc. This worksheet also took the Magongo Mosque Outreach Council through the thought process of the burden of malaria on the different groups. And they considered whether they had a unique opportunity to reach these groups. Also, whether it is in the power of the target audience to change certain malaria-related behaviors. So this slide shows just a few of the key audiences within this mosque as an example. There were several others. Examining these groups helped the Magongo Mosque Outreach Council to better target their malaria activities. The third step is about identifying organizational strengths and assets. This is a great exercise that can help us think outside the box of the usual types of activities a religious or community organization might do when considering integrating malaria activities into their ongoing activities. Now we have a question that we would like you to type into the chat box. What are examples of some of the types of assets, time, resources, experience, that faith and community organizations have that could be used to promote malaria prevention and treatment in your local communities? Please add your responses in the chat box. So please enter in the chat box. Okay, we have one great answer so far. That's credibility. Respect, excellent. Trust, that's a good one. Okay, now the answers are coming in. Fantastic. Trust, time, members, convening power. Super. Accountability. I like that. Let's take 20 more seconds. Contact points, conscience, ownership, transparency, influence. Wow, these are great answers. Integrity, trust, compromise, responsibility, cultural habits of the local population. Yeah, all really super answers. Fantastic. Great answers, everyone. Thank you so much. Thank you so much. So if we look to our example again, the Magongo Mosque Outreach Council, they mapped out their assets using one of the worksheets in the toolkit. So as we can see, there are a number of groups, institutions, physical spaces, individuals, and opportunities within the local economy that could potentially be leveraged for malaria activities. We can see that there are women's microcredit group associations, mothers groups, football teams and clubs, trade unions, political groups. We can see that there is physical space at the sub-county planning office boardroom, the schoolyard, the madrasa yard, soccer pitch. There are local NGOs, international NGOs. There are some individuals such as students, parents, and all of the gifts and traits of those folks, those individuals. And then the local economy as well, the for-profit micro businesses. So it was actually a bit of a surprise when the Magongo Mosque Outreach Council mapped out all of their assets. And this was a useful exercise, not just for their malaria activities, but for their activities as a whole. So the next step, step 4, asks users to consider the timing of their malaria activities, considering local high transmission times, other complementary activities going on, and local timing for events that might present a good opportunity to do a malaria activity. Equally important are times when it is not appropriate to do malaria activities. if there were an ongoing immunization effort, for example. You would not want to take attention away from the immunization activity necessarily unless you could find a time and place where there was an opportunity for synergy. So we're going to have another poll question now. Don't forget to click on your answers and hit submit. What time of year is malaria transmission the highest? The dry season, the rainy season, or in between the dry season and the rainy season? And again, this question may be not new for some of the folks on this call, but hopefully those who are new to malaria and new to social and behavior change will have a chance to learn. I see some people are typing their answers in the chat box as well. That's absolutely fine. Thank you, Fortunate. I think we'll take just a few more seconds. Great. Okay. So we will wrap up this poll now. Let's see. Yes, most people did answer correctly. 84% answered the rainy season, and in most countries that is the case, where it's the rainy season or just after the rainy season, where there's lots of cases of malaria. But again, please confirm this with your local Ministry of Health National Malaria Control Program representative in your area, because they have the most current information on malaria rates in your area. So well done. So the fifth step asks users to define their malaria activities. After considering the malaria context, the key actions to promote their target audiences, and key strengths and opportunities. So the toolkit has a worksheet that can help guide users in figuring out the details of their malaria activities. We can see on the next slide how our example organization, the Magongo Mosque Outreach Council, completed this exercise around the key action to promote malaria in pregnancy. They have thought through their target audience, young women who are first-time mothers, and want to encourage them to report early and often for antenatal care services. They have thought through how this behavior aligns with their organizational and community values. They've thought through barriers and facilitators for this behavior, and they developed a key promise and supporting points, so they are very ready with a clear message during their activity. There are a large number of activities that religious and community-based organizations might do for malaria. We have a few listed here. Can you go to the next slide, please, Ashley? A few here just to get you started in thinking. Some of these are very common types of activities, such as home visits, sermons and faith-based gatherings, naming days, rites of passage events. There's social media, community gatherings, market days, visits and talks with schools and children, women's groups, microcredit groups, Bible Sunday school groups, Scout Sunday School, unions, madrasas, creches, village health committees, and this is just the tip of the iceberg. There are so many different types of activities that community and faith-based leaders are already involved in that they could easily tack on malaria activities to. So the next step is around tailoring your messages so they best resonate with your target audience. Key messages need to address relevant benefits, concerns, and practices in your community. They need to be framed by the cultural context, and they need to convey a key promise or benefit for your target audience. They also need to be actionable. While it may seem that developing a well-tailored message is an easy task, in fact, it takes a lot of thought and work. Good messages address all of the 7 C's for effective communication. First, they command attention. They attract and hold the audience's attention, and they make it memorable. They clarify the message. The message must be very clear and easy to understand. Less is more. The more details you add, the more confusing it can be. They must communicate a benefit. They must stress the advantage of adopting a new behavior being promoted. Why change a behavior? What is in it for me? Consistency counts. Repeat the same message consistently to avoid confusion and enhance the impact of the message. We actually see this often in countries where different partners are saying similar things, but they actually are saying them slightly different, so it can confuse the target audience. Create trust. The credibility of messages is important. Without trust and credibility, the message will go unheeded. Now, some of us have already mentioned that there's trust already inherent with religious and community leaders, which is a fantastic opportunity to leverage on that trust. Cater to the heart and the head. People are swayed by facts and emotions. Use both to maximize the persuasiveness of the message. And the seventh C is a call to action. Be very clear about the action that you want people to do. Be very precise in what you want people to do exactly. Otherwise, it could be left up to people to decide on their own. They may not always do the exact right action that you want them to do. So the next few slides show how our example, the Magongo Mosque Outreach Council, thought very hard about tailoring their message for malaria and pregnancy activities with the husbands of new mothers, pregnant women. So they thought through this audience within their mosque, husbands of pregnant women. And they thought, you know, many husbands about 20 to 60 years old attend the mosque, but their pregnant wives don't necessarily attend the local ANC services early and often. Husbands often come and ask for prayers for their wives who are sick with malaria. And some of their wives in the congregation have lost babies in pregnancy due to malaria, and a few women have even died. So what is the desired behavior? The desired behavior, the practice, the action that we want women to take. We want all pregnant women to attend antenatal care visits early and often, starting as soon as they suspect that they're pregnant. And during these visits, they should collect their free insecticide treated net and receive preventative malaria medications. That's the desired behavior. The Magongo Mosque Outreach Council found that in the local ANC services, only 60% of women go to the health facility once during their pregnancy, and that's to deliver their babies. 20% attend it twice or more. 20% don't attend at all and deliver at home. And 75% of men surveyed said they do not support their wives to attend ANC because they think it's a waste of time. Next slide. So the priority behaviors for change that the Magongo Mosque Outreach Council worked through is they thought that these husbands should really support their wives with time and resources to ensure that the pregnant wives can attend ANC early and often. And that these wives and husbands need to discuss the received ANC services and make sure that malaria services were offered. And although there had been a social norm against reporting early for ANC, both among peers and sometimes even health providers at the facility, that was certainly a barrier. There was also another barrier about limited resources. So sparing money for transportation meant not spending money on something couples would normally spend on. So while those are barriers, the key constraint was really about this belief about that going to ANC early and often was a waste of time. So who are the key influencers? The Magongo Mosque Outreach Council identified peers, religious leaders, community leaders, and mother-in-laws as key influencers for these husbands of new mothers and pregnant women. So they developed this key process and these support statements. So they said, we would like the husbands of pregnant women to prioritize early and often antenatal care attendance for their pregnant wives in order to prevent malaria in pregnancy for a healthier baby and mother. And their support statements spoke to the health of the mothers. Women who attend ANC early have healthier births, and babies who survive their first 5 years of life. There are a number of other support statements, I won't go into all of them, that they came up with in consultation with their local antenatal care providers, the health providers themselves, and the malaria, county malaria control focal point. They also came up with a promise statement for these men. If your pregnant wife attends ANC early and often, she will receive malaria prevention medication and an ITN, insecticide treated net, which will help her baby and herself to stay healthy during the pregnancy, which will ensure a happy, healthy family. So this is a very nuanced exercise, but it was a really important exercise for them to work through, so they could be very clear about what messages they were giving to their desired audience, which in this case are the men, the husbands of the pregnant women. Okay, so they've also come up with some key messages, and the actual activities they're going to do are religious talks around Father's Day, home visits to homes with pregnant women. I think that someone brought up a point about COVID and other pandemics as we're thinking about activities, an absolutely good point, and one we'll talk about very soon. And then also discussing with a Mosque's men group how they can change the norm and facilitating some discussions around that. So that was, a bit of investment in time, but just to talk you through how the Magongo Mosque Outreach Council went through to define their activities and really tailor their message. Okay, next slide. So we have another poll question here. Do you think that you will be able to integrate malaria into your existing activities? Yes, easily. Yes, but it will take some time and work, or no? So based on what you've seen so far, do you think you will be able to integrate malaria into your existing activities? Yes, easily. Yes, but it will take some time and work, or no? Okay, we'll give just a few more seconds. This one hopefully shouldn't take too much time. Great. All right, let's go ahead and wrap that up. Okay, so the majority of folks think that it would be an easy lift, something that's easily done to integrate malaria into your existing activities. Some of you are already malaria experts, so of course that stands to reason. But for those of you who are new to this, we're very pleased to hear that. And yes, but it will take some time and work is a very fair answer. We are very pleased to hear this, and we are available as resources to help you work through how that looks and how to do it. So thank you very much for those answers. So the seventh step is really tracking the progress, which helps you, this step helps you monitor and evaluate the progress for your different activities. And there are a number of tools and templates to help make tracking easy. The next piece was brought up in the chat box, and I think it's a very, very good point. During this unprecedented time of COVID, the toolkit also introduces COVID considerations to help make sure that malaria activities do not inadvertently become opportunities for COVID-19 transmission. Since COVID and malaria share some key symptoms, it is more important than ever for everybody in malaria endemic areas to seek care for fever to make sure we are not missing easy to treat malaria cases. There should not be malaria deaths during this time. And unfortunately, in some places, there are some increases. And, I think that, there's a correlation with COVID and some fear around that. So while we don't want the malaria activities to be a point of spreading COVID, we also do want to make sure that the activities are done in a safe way, and also that we really get folks to seek care for fever so we don't miss those malaria cases. So this module also has a large number of additional resources at your disposal. They're well vetted and a very high quality. So those are available for you to use at your leisure. And the last module is advocacy. And we've included advocacy specifically because it really, although it fits under the umbrella of social and behavior change interventions, religious and community leaders are really well placed to be good advocates for local health and malaria policy and domestic resource mobilization. So this module shows users how they can help communities raise political will and additional malaria resources and use the available resources that are currently available better. So this module includes sections about engaging with other leaders and building interest. Next slide. Yeah, thank you. And I think that it should be said that a number of countries are participating in the advocacy Zero Malaria Starts With Me campaigns. And so this is a good opportunity, if you've heard about that, to see where the advocacy activities can intersect with the social and behavior change ongoing activities. Next slide. So here are some key dates to keep in mind in the malaria world. One is just around the corner. April 25th is World Malaria Day. June 13th is World Children's Day. August 20th is World Mosquito Day. November 6th is SADC Malaria Day in Southern African Development Community. March 8th is International Women's Day, as we know that recently happened. Any holidays when people travel are an opportunity to further malaria transmission. And they're also a great opportunity to remind your stakeholders to prevent and treat malaria. So while you have some people who might be moving out to different areas, you will have other people moving into your area. So it's a chance to expand your reach even further with your activities. So next slide. As I mentioned, World Malaria Day is coming up. So what can you do around World Malaria Day that's easy and low or no cost? Here are just a few examples. And if you have other examples, I would love if you would type it in the chat box. You could talk about the malaria prevention actions, for example, during your sermons or khutbahs that week. You can find out what malaria partners in your area are going to be doing, and you can show up to lend your support to those events. You could ask families around World Malaria Day while you're doing home visits if they have treated mosquito nets, if they're hanging over their beds, and if they're sleeping under them. And if you see a child that is unwell at any time, you could advise their caretakers to take them to a health facility quickly. These are just 4 off the top of our head examples. If there's other examples you can think about around World Malaria Day that are easy, low cost or no cost, that community or faith-based leaders, faith-based organizational leaders could do, please let us know in the chat box. But it's to say that there are probably already activities that are going to be happening around you that you could join, or you could do some activities of your own, just tagging malaria messaging into what you're already doing. So our ongoing example, the Magongo Mosque Outreach Council. So what did they end up doing? So after working through this process of looking at their values, looking at the opportunities, looking at their strengths and weaknesses, and looking at the target audiences, here's what they decided to do. So they invited the county malaria focal person to speak to the congregation about malaria prevention and treatment the week before World Malaria Day. And they reached about 400 people during the Friday prayers. The council met with the county malaria focal person and they discussed ways to work together. And then the whole council attended the county's World Malaria Day celebrations in person. at that invitation of the county malaria focal person. For Mother's Day activities, they incorporated malaria into the religious messaging around Mother's Day, and they reached about 350 people during Friday prayers. They had some Father's Day men's group activities. Men's groups visited homes to help those homes that had unhung nets. They assisted with hanging the treated mosquito nets that were tucked under the beds, still in the plastic. And they were able to hang 143 nets that had been packed away. And then the imam's house visits now include encouraging antenatal care attendance early and often as part of his routine discussions. And he's already had this discussion with 83 homes in the area. And during Eid, print materials about malaria from a malaria partner were distributed through the mosque. And the mosque agreed to be a distribution point for the upcoming mass insecticide treated net campaign as well. So just through some conversations and some careful thought, the Magongo Mosque Outreach Council was really able to come up with a number of activities that are not time or resource intensive that add to the malaria effort going on in that area. Okay, next slide. So I mentioned at the beginning of the webinar that there's a frequently asked questions section, and this really prepares the toolkit users for questions or issues that might come up and how to respond effectively and correctly. There are many myths and misconceptions about malaria out there, and so there is now a source specifically for religious and community-based leaders to be able to have a source to turn to when they're confused themselves about the answers. So again, this toolkit is yours for use. Adapt it as you need it. Use the parts that are useful to you, translate it into languages. You know, really it's a resource for you to use at your leisure. As I mentioned, please consult the local health authorities if you want to change any of the key actions to promote, though. So we do want to hear from you. So after World Malaria Day, we are going to send you a survey to see what you think about the toolkit, what's working, what's not working, and how are you using the toolkit. So please, you know, expect to hear from us, and we would love to hear what kinds of examples come from this group. So how can we connect with others who are using this toolkit and hear about their experiences? There's a special online group that allows the users of this toolkit to share their experiences. It's an online group that we're going to hear about shortly from my colleague Jean. And this group is especially for users of this toolkit to go and talk about maybe ways in which they're struggling with using it or examples of great things that they've done. It's a great time to brag about the great work that's going on and also to get ideas from others about what they're doing. Thank you very much. I'm going to hand over to Jean now to take us through how to become a part of that online community. Thank you, Jean.
Merci Anna. Bonjour à tous, bonjour.
Thank you, Anna, and thank you, everyone. Thank you all to all the partners. My name is Jean-Jacques Brou, and I am the leader for Springboard. Springboard is a platform for specialists of SBC. It is for sharing and learning via Springboard. We have a program that is funded by USAID. Springboard is a community with more than 3,000 professionals of SBC. Next, please. Springboard was launched in April 2014, and its mission was to promote the exchange of knowledge, networking, and learning between professionals. Next, please. And now, what is the reason to join Springboard? Springboard will reinforce your skills of SBC. It's going to give you new insights of SBC. You'll be able to access webinars, discussions, and also groups. And you'll also have excellent resources. Next, please. Since 2014, the community is increasing each day. Today, we have more than 3,000 members in more than 90 countries in the world and more than 1,200 members in Africa. And we now have Francophone members that are almost equal in number as our Anglophone members. We also have information about donors, researchers, we have students, we have also other specialists as SBC specialists. Next, please. How does an excellent platform as Springboard work? So to be able to access Springboard, you will have to ask for membership using the link that you see in the slide. Next, you need to click on Request to Join or Login. If you need to just log in, if you already have an account with Springboard. Next, please. We are going to ask some information from you that you need to fill out, and then you just have to submit your request, as you can see here, and then you'll have to give this information. Next, please. After sending the request, you need to check your email because you will be receiving an email that will let you create your password that will have 10 characters minimum. You will need to give personal information again and professional information too. And then you will need to create a password with 10 characters minimum, and you will be able to synchronize your social networks to Springboard if needed. Next, please. Thank you. So how can you link your password to your social network to Springboard? You can choose your network, social network. It'll be LinkedIn, Facebook, or Google, and you can ask for it to be synchronized.
Merci. Donc, ici, nous voyons l'interface.
And here you can see Springboard once you are connected and log into Springboard. As you can see, we have different tabs so that it is easier for the users to navigate. First, you have the activities, then you have resources, and as you can see, we also have the group tabs, and you have different communities of SBC. We have, for example, the group Malaria, SBC for community leaders will be open today. We have the other tabs that you can explore. For example, to reinforce, to strengthen our capacities or our skills. Next, please.
Merci. Sur Springboard, nous avons créé un
Here
groupe.
in Springboard, we have a group. It's a private group called Leaders, Malaria Social and Behavior Change Toolkit for Community and Faith Leaders. And you can have and come into this community and join this group. If you want to join this group, you need to click on the group tab on Springboard, and then you need to click on search to the right of your screen. And then you need to put the Malaria Social and Behavior Change Toolkit for Community and Faith Leaders. And then you have to click on search so that you can access the group. Here you can see the group page, and you'll have to click on this page so that you can access the group. Next slide, please. Thank you. Once you click on this group page, you will be able to join this group that you are seeing here in this slide. And this is the group page, Malaria Social and Behavior Change Toolkit for Community and Faith Leaders. But this group is private. So since it's private, you have to click on the right side of your screen and ask to be a member. And then an administrator of the group will be able to accept you into the group, and you'll be able to join the group. Next, please.
OK. Le groupe Springboard.
The Springboard group has great resources for the SBC, and it is focused on community leaders and faith leaders. You'll have quality resources, and you have to click on Media Center, as you can see here. And once you enter into the group, you have to choose the file, and you can see all the resources available.
Merci. Slide suivant.
Next slide, please.
Ici, vous voyez deux liens. Donc,
Here you can see two links. The first link is the link for the video presentation, and you'll see a presentation with a lot of details that you can see and you can watch so that you can explore other benefits of Springboard. And the second link, as you can see, is the link that will enable you to join the Springboard community. If you are not a member of Springboard yet, join us today. Use this link, the link that you see on your screen on the slide, and you can ask to be a member.
Merci. Slide suivant.
Next, please.
Merci. Ainsi prend fin ma présentation.
Thank you very much. And this is the end of my presentation for Springboard. And this is the community for, it's a community for SBC professionals. And I'm here if you have any questions about Springboard. Thank you so much for your attention. And now I would like to give the floor to Amory. Avery, you now have the floor. Thank you.
Thank you, Anna and Jean, for the insightful presentations. I'm Ava Verkatis. I'm co-lead for the Interagency Social and Behavior Change Technical Team for the U.S. President's Malaria Initiative. I hope that everyone on this call found these presentations helpful for your work. Community and faith leaders play a vital role in malaria prevention, and PMI is dedicated to supporting this work. As Jordan and Anna have mentioned, World Malaria Day is only a few weeks away, and we hope that you will use the resources discussed today to plan and implement activities in the communities you serve so that we can work together to defeat malaria. PMI and Breakthrough Action both look forward to seeing how and learning about how you're utilizing this toolkit. We can now take several questions about both the toolkit and the Springboard group. Please submit your questions in the Q&A box and comments in the chat box. So first step, I think the first question that I wanted to pose was from Sabit, and it was, I think to Anna, if you could sort of respond on, when you talk about community leader, what does that include? Does that include both formal and informal leaders, or is it more just opinion leaders in general?
Yeah, that's a super question, Sabit. Thank you so much for asking it. And you know, a community leader could be anybody with influence in the community. So it could be informal, it could be formal. This toolkit is obviously made for, designed for an audience that can read, but there's no reason that it couldn't be taken, you know, by yourself, for example, and turned into a toolkit that could be accessed by those that are not literate, for example. But you know, any opinion leader, any community leader that has influence in the community, that has followers in the community, could be tapped into to be, you know, someone who could use this toolkit. Thanks.
Great, thanks, Anna. Up next, we have a question from Ibrahima, and it's about the example that you provided. So in the Mosque of Magongo, did you collect data on the awareness raising campaign? If so, what sort of indicators were collected, and how might these data be used to sort of inform decision making?
It's a really, really nice question. Thank you. I think something that we need to remember is that the religious and community-based organizations that are taking these activities on are not SBC, not social and behavior change organizations normally. They are, you know, organizations with different missions that overlap with the malaria, you know, mandates. So we should be reasonable with the expectations that we have for data collection, while maintaining that the activities are of good quality. And so in this case, it was really mostly output data that we collected, and you know, numbers of people reached, numbers of people that were there. Certainly there could be more indicators that could be collected. You know, you could do exit surveys to find out what people understood about the messages. You know, I think that these are the first activities that are happening. And, you know, as time goes on and more activities happen, the more sophisticated types of indicators you might be able to collect. But we don't want to put too much additional burden on these organizations as far as data collection for very, you know, detailed SBC type indicators. But I think that that is something that develops over time as the activities mature. But, you know, I think for the immediate, for World Malaria Day, we would love to have some activities with some great output indicators, you know, output indicators meaning numbers of people reached, you know, numbers of people involved in the different activities. So we can get a sense of the value add without getting too far into the weeds of SBC indicators.
Great, thanks, Anna. So the next question we have up is from Tope, which is about sort of how we motivate religious leaders. What are sort of some of the approaches that are used to motivate religious leaders to implement these types of activities? In some of the examples that were provided, were incentives used? Any sort of guidance or sort of comment on that piece?
Mm-hmm. Well, I can only speak to these examples, and I can say that there were no financial incentives of any kind. I might actually pose that question back to you, Avery or Jordan. I don't know if, so there was a summit that PMI hosted a few years ago in which a number of religious and community-based organizations participated, and they went, this was in Arusha, Tanzania. They went back to their home countries and a number did different activities. Were there any financial or in-kind motivations for those groups?
I'm happy to answer. So there was not any sort of in-kind or financial motivation from those groups. I think what we've found in our experience is that this sort of fits in nicely to the sort of existing mission of a lot of these organizations and is part of sort of the regular community service that's really integrated into a lot of faith and community organizations. And so the additional incentives or sort of in-kind incentives, whether or financial incentives, weren't necessarily necessary to promote sort of that participation, but there was a desire and a drive to contribute to this sort of overall goal of malaria control and elimination, recognizing how important it is for ensuring the health and welfare of these communities. So maybe going next, I think there was another question, which I think is an important one. And I think we touched on it briefly, but maybe to sort of dig into a little bit more about this issue of channel selection and how you really determine what's the most effective channel or sort of medium of communication. I think you sort of gave us some examples, but maybe if you wanted to expand on that, I think it'd be great.
Yeah, thanks for that. And thank you, Tope, for that question. And it's a good one. You know, when we're thinking about SBC programs at a national level, we can think really big as far as different types of mass media and different channels goes. But in the case of thinking about very kind of, you know, where the religious and community-based organizations sit, there really tends to be a lot more interpersonal communication channels, different types of social mobilization techniques. And perhaps we should add some more examples to the toolkit. I think that's not a bad idea. But we did list a number of different types of activities, interpersonal and community mobilization type activities that are very normal activities that these types of organizations are involved with. I know you're from Nigeria, and I know that in Nigeria, actually, some of the churches do have access to much larger mass media types of channels. That is not the norm in most countries, I guess. So I think that we'll take your suggestion and tweak the toolkit a bit to have more guidance on that. But usually at the community and faith-based organizational level, at the local level, it tends to be more interpersonal types of communication, community activities.
Great, yeah, and I think I would just echo that as well. I mean, I think thinking about, and I think Anna also touched on this, the resources and the activities that faith and community organizations are already doing, and a lot of times those have sort of pre-existing channels, or already are a channel. It's sort of interpersonal communication or community mobilization or sort of those group activities really provide a sort of great inroads into the community and can be the appropriate sort of determining factor for the channel that you're selecting. So I think with that, I think one last question, just recognizing the time. I think the sort of last question I wanted to ask was around sort of collaborating. Any sort of best practices or suggestions for sort of getting religious leaders and faith and community organizations on board, and how you might work with them? Thanks, Anna.
Absolutely. It's a great question, Avery. Thank you. A number of countries have a social and behavior change working groups set up at the national level and even at the subnational, sometimes even the district level or state level or district level or lower level. So that is a great opportunity where malaria, SBC, social and behavior change stakeholders are already sitting around the table. They're already collaborating on activities, the timing of activities, the content of activities, the materials. So this is a great place to find out what people are already doing and how you can add value or how they could add value to your activities as well. You can get the information on these different working groups through your local Ministry of Health or National Malaria Control Program representative. And in the case where one doesn't exist, that's something that I think could be a great first step, is establishing those groups. These are unfunded groups usually, but anytime there's a number of malaria partners in an area, they're usually getting together, or they should be getting together to talk about activities to make sure they're not overlapping. And so I think that's a really good opportunity. And World Malaria Day is a great place to show up for those activities happening in your community and find out who's there. And it's a great place to start asking questions and about how you can get more involved. Thank you.
Thanks so much, Anna. And once again, thank you to all of our presenters and all of our participants for the questions and the engagement throughout the webinar. Our presenters will type answers to any of the remaining questions that are submitted in the Q&A box, or share answers in the email recap and on Springboard. So I'll now pass the floor to Jordan to close today's webinar.
Very much, Avery, and thank you again to everyone that's joined today's webinar. We've had such great participation from everyone, and we really appreciate you taking the time to spend with us today. We encourage you to share the Malaria SBC Toolkit for community faith and leaders with other community and faith organizations in your networks. And we also hope to continue our conversations through our online community of practice in the Springboard application in the Toolkit group. And again, remember that the full name of that group is the Malaria Social and Behavior Change Toolkit for Community and Faith Leaders Group. So again, we really, really appreciate your participation today. So thank you to all.